Yes, start please.
ओके। गुड आफ्टरनून, नमस्कार। मैं डॉक्टर भुवनेश्वर पांडे डाबर परिवार की तरफ से आप सभी लोगों का स्वागत करना चाहता हूं, अभिनंदन करना चाहता हूं इस मार्च महीने के हमारे रस संवाद के लिए। हम सभी को अवगत है कि हम हर माह एक रस संवाद का आयोजन करते हैं, डिजिटल रस वेबिनार का, तो जिसपे कि हम पूरे ऑल ओवर इंडिया से कुछ चुनिंदे रस वैद्यों को अपने प्लेटफॉर्म पे लेके आते हैं और उनके साथ हम रस चर्चा या संवाद करते हैं। उसी श्रृंखला में मैं आज के हमारे मेहमान का स्वागत करना चाहूँगा। सर के बारे में अगर मैं बताना चाहूँ, डॉक्टर रमादास मंगती सर, currently he is working as a HOD and the head principal of श्री धन्वंतरी आयुर्वेद कॉलेज हॉस्पिटल चंडीगढ़। इससे पहले कि अगर मैं सर की बात करना चाहूँ तो उनके पास करीब 35 साल का एक 35 साल का एक प्रोफेशनल अनुभव है और जिसमें कि 28 साल का सिर्फ टीचिंग एक्सपीरियंस भी है। तो एक 35 साल का उनके पास एक चिकित्सा का जो अनुभव है, उसके बारे में हम आज बात करना चाहेंगे कि कैसे हम रसायन औषधियों के द्वारा स्पेशली स्पाइनल और मस्कुलोस्केलेटल डिजीजेज या डिसऑर्डर्स पे हम कैसे काम कर सकते हैं, कैसे इन औषधियों का हम यूज कर सकते हैं इन तमाम तरह की वात व्याधियों में। सर के बारे में अगर मैं बताना चाहूँ तो सर ने श्री जनेंद्र सरस्वती आयुर्वेद कॉलेज चेन्नई में भी 22 वर्षों तक अपनी सेवा दी है and he is the board of management and board of studies academic counseling of SCSMV कंचीपुरम also. Currently सर हमारे धन्वंतरी आयुर्वेद कॉलेज में प्रधानाचार्य और हेड ऑफ द डिपार्टमेंट का चिकित्सा के तौर पर कार्यरत हैं और वहाँ पे अपने चिकित्सीय अनुभव से और अपने OPD से तमाम लोगों का चीड़ व्याधियों का ट्रीटमेंट करते आ रहे हैं। मैं सर ओवर टू यू सर। एंड मीनवाइल मैं आप सभी लोगों से रिक्वेस्ट करना चाहूँगा, अगर आपकी कोई क्वेरी होती है या कोई भी क्वेश्चंस होते हैं तो आप चैट बॉक्स पे प्लीज़ उसे पेश कर लीजिए। हम सेशन के एंड पे उसका क्वेश्चन आंसर्स और उसके आंसर्स देने का प्रयास करेंगे। तो आपकी कोई भी क्वेरी होती है तो एंड ऑफ द सेशन आप लोग प्लीज़ उसे चैट बॉक्स में भेज दें। ओवर टू यू सर, प्लीज़।
Good afternoon, one and all. At the outset, I would like to thank Dr. Bhuvneshwar Pandey, Product Manager, Dabur India Limited, Dr. Durga Prasad, Senior General Manager, Marketing, Dabur India Limited, and सभी डाबर परिवार के लिए thanks बोलना चाहता हूँ. So an opportunity has been given for me to speak on ras rasayanas in spinal and musculoskeletal disorders. Pranams to Acharyas of Kanchikamakoti Kanchipuram, Tamil Nadu. Today's lecture, scope of this lecture, scope of Ayurveda in spinal disorders, strengths and weaknesses of Ayurveda in spinal disorders, economic potential of Ayurveda, and limitations and appropriate time to refer cases to other system of medicine. Why we have to speak the scope of means, in my vast experience, I have understood that various varieties of spinal disorders can be managed successfully with Ayurvedic treatment. Majority of the cases we can manage. Only in case of trauma and other situations only, there is a requirement of multi-specialty approach. Otherwise, majority of the cases, even in OPD level also we can manage. Then there is a huge economic potential in Ayurveda. In the next slides, we are going to see. It is not that every case of spinal disorder we can handle. Certain of the cases, there is a requirement for other system of medicine also. Throughout world, when we see the most common cause of disability as per in 2018 statistics, Low back is the most common cause of disability. Maximum number of people are suffering. Next, country-wise leading cause of disability, if we see India, Brazil, Australia, Russia, South Africa, Japan, all these, and even Saudi Arabia, these countries, leading cause of disability is low backache. Means those many number of patients are suffering, and this is a good area for Ayurvedic practitioners to take it as a profession. Low backache prevalence in India in 2022, average 51% of Indian population are suffering from low backache. In a lifetime, at least once a person is suffering from low back, like that 66% of Indian population are suffering from low backache. Prevalence rates were highest among females, rural population, and elementary workers. Global age-wise, maximum 60 years plus age people more suffering, and apart from that, in between 44 and 60 years, 1,200 people are suffering. Global cost estimate data for treating low backache. In USA, the direct cost of estimate will be $9,231 per patient. Indirect cost estimate is $10,143 per patient. Means it will be in billions per annum. Similarly, in Europe, 2.3 billion to 2.6 billion direct costs, and a maximum of 8.15 billions of indirect cost. Economic burden of low back pain in India. The total low back pain costs will be 5.4 million. Acute low backache pain will cost, the average cost involved is 0.92 million US dollars, and chronic low back pain around $4.48 million. Leading cause of spinal cord injuries globally in 2009, out of falls 4,77,000 cases, road injuries 2,30,000 cases. Road accident and spinal disability in India 2022, total road accidents 4,61,312. Total injuries 4,43,366, and spinal cord injuries are 1,95,081 cases. Then, in brief, we will look into the theoretical aspect of spine and various spinal disorders, and I'll speak more about my experience in later slides. So all of us, we are aware that it contains total cervical 8 nerves, thoracic 12, lumbar 5, sacral 5, and coccygeal 1. Total 31 pairs of nerves are there in. Certainly, when patients are coming, when they are bringing various investigations, these are the common terminologies we'll come across, like spondylosis. Spondylosis is the degeneration of vertebral column from any cause. If the vertebra of the neck are involved, it is labeled as cervical spondylitis. If vertebra of the lower back spondylosis is labeled as lumbar spondylitis. And spondylosis can occur any part of the spinal cord. And the reasons are years of constant abnormal pressure caused by joint subluxation, stress induced by sports, acute and repetitive trauma, and poor posture. Spondylosis can affect any person at any age. However, older people are more susceptible. Diagnosis: those with neck pain only with any positive neurological findings usually do not require any X-ray of the cervical spine. Means patients, when they are coming with simple neck pain, at that juncture, initially we can manage with medications. But if they are expressing any symptoms of pain relating to hand or other symptoms, certainly those cases require investigations. And similarly, the patients, if they are suffering for more than 3 to 4 weeks, certainly it's better to subject the patients for investigations. Spondylolisthesis is the displacement of one spinal vertebra over the other vertebra inferior to it. Spondylolisthesis most commonly occurs in lumbar spine and primarily at L5 and S1 levels, with L5 vertebral body anteriorly translating over the S1 vertebral body. The listhesis may also occur even in cervical area, but less common. But anywhere it may happen. Spondylitis. Spondylitis is an inflammation of vertebra and vertebral discs, vertebral joints. It involves one or more vertebral joints. Usually examples are ankylosing spondylitis or spondyloarthropathy, TB spine, injury on spine. It affects any part of the spine or the entire spine in case of ankylosing spondylitis. Spinal stenosis. It happens when the spaces in the spine narrow and they create pressure on the spinal cord and nerve roots. Most commonly, it happens in cervical and lumbar regions. Disc prolapse, also called as slip discs or herniated discs, which happens when the nucleus pushes out through the tear of annulus, most commonly in lumbar and cervical areas. Neural foramina stenosis and nerve root compressions. It occurs when the openings where the spinal nerves exit the spinal cord become narrowed within the neck or low back. Commonly happens in lumbar and cervical area. Nerve root compression, pinched nerves, happens when the nerve in the neck is compressed or irritated, where it branches away from the spinal cord. It leads to radiculopathy. Osteoporotic compressive fractures. Reduced bone mass and architectural deterioration of bone is common in osteoporosis. This leads to fragility of fracture, which is defined as fracture with minimal trauma. Sacralization of vertebrae, a congenital vertebral anomaly of the lumbosacral spine, where the base of the spine has fused to the top of the pelvis. It happens before birth itself, while formation of bones in the fetus stage itself. L5 vertebra fuses with S1 vertebra, complete or partial. Cauda equina. It is a condition where the collection of nerves at the end of the spinal cord due to its resemblance to the horsetail. It is continuation of the nerve roots in the lumbar and the sacral region. Cauda equina syndrome occurs when there is dysfunction of multiple lumbar and sacral nerve roots of the cauda equina. It mostly occurs from massive herniated disc in lumbar region. Signs and symptoms we are going to see later. Coccygeal injuries, also called as tailbone pain, which can have causes that are due to underlying disease, prolonged sitting on hard surfaces, unpadded seat, trauma to tailbone, cycling. Signs and symptoms also we'll discuss later. Spinal cord injury, these depend on the extent and location of the injury, which may lead to quadriplegia or paraplegia, numbness of the lower limbs, and bowel and bladder incontinence. Spondylolisthesis types. Forward displacement of the vertebrae, it is called anterolisthesis. Backward retrolisthesis. And there is a possibility of on either side lateral listhesis also. This is the chart I have prepared because all these, whatever I am showing in this chart, I have come across in my practice. Earlier we have seen the definitions of various technical terms. When we are coming across investigations, patients will come with either 1 or 2 or 3 mixed diagnoses, maybe a patient with spondylolysis, with disc prolapse, maybe with impingement of nerves. Like that we come across in our investigations, especially patients who are chronic sufferers. They come with more than 1 or 2 or 3 pathologies. So in neck, it is when it is happening in neck, cervical spondylosis, cervical spondylolisthesis, spondylitis, cervical disc prolapse, compression of nerve roots, cervical canal stenosis, cervical neural foramina stenosis, like that we'll call. And at that juncture, it is localized to the neck, and the symptoms they appear and show they radiate to the both upper limbs. So in thoracic region, usually the common problems are kyphosis, scoliosis, TB spine, and osteoporotic vertebral compressive fractures. In lumbar and sacral, already disc prolapse, lumbar disc prolapse, lumbar spondylolisthesis, secondary canal stenosis, bilateral neural foramina stenosis, or unilateral sacralization of vertebra column. Similarly, coccygeal injuries and coccygeal pain. Throughout spine, ankylosing inflammatory disorder, ankylosing spondylitis, and there is a possibility of injury to any part of the spine depending on the hit. So when we speak of spinal disorders, these are the commonest things we'll come across. There are so many other things also available, that is intramedullary tumors, extramedullary tumors. So many other spinal disorders are available, but these are the commonest problems we'll come across. What are the descriptions available in Ayurveda? And probably everyone, all of you are aware, but most of the practitioners might have joined. They are available in the textbooks. You can easily go through and you can follow in the textbook. Pada Sula, Pada Brahmsa, Pada Suktata, Vata Kundata, and Gridrasi, Ursada, and Pangulya. These are various types of Shronibeda, Kanjatva, Kubjatva, Trikagraha, Prushtagraha, Bahusosha, Grivastamba, Madhyastamba, Gridrasi. These are all various disorders told in Ayurvedic textbooks, which are related to various problems of spine. All of you are aware that for all neurological disorders, according to our science, they have told only common nidana. In this, most important is excessive movement such as leaping, jumping, wayfaring, and physical exercise related to the spinal disorders. Excessive emaciation due to anxiety, grief, illness, uncomfortable bed and seat. Suppression of urges also, probably nowadays people are unaware, and most commonly we are doing. Amadosha, injury, fasting, injury to vital parts, falling down from elephants, horses, and other fast vehicles. Nowadays, probably, even nowadays also, horses and elephants are available, but nowadays road accidents we can take in this particular column. Most of the road accidents, people are suffering from spinal injuries and spinal problems. The aggravated vayu, especially when it is located in the spinal cord, it affects the spinal cord and the various nerve roots, affecting the upper and lower limbs of the body. So there is a clear-cut description about this sciatica in our science. This is Grudrasi. Grudrasi starts from hip and gradually comes down to the waist, back, thigh, knee, leg, and foot, and affects these parts with stiffness, distress, and piercing pain, and also frequent quivering. So when it is of two types, Vata and Vata Kapha. So these are the treatments mentioned. But today we are going to discuss about more of Semana, Chikitsa, and other medicaments, as well as some of the few external Panchakarma procedures we are going to discuss. This is Khalli Vata. This is also, Khalli is the disease which causes distortion, twisting of the feet, forelegs, thighs, fingers, and hands and arms. May be compared to any of the radiculopathies only. This is the treatment. Kanja and Pangu, suppose if the root compression is so severe and if it affects on one side of the body, there is a possibility of loss of function of one limb, or otherwise, if it happens on both limbs, loss of function of both limbs, monoplegia and paraplegia. Kalaya Kajja, letharism. So this is the way the people, they bring either x-rays or reports. So we can see the degeneration and the narrowing of the disc intervertebral spaces. These are the things. This is cervical spondylolisthesis. Usually less common. It's more common in lumbar area. This is cervical stenosis. Usually in lumbar area, the canal should be 15 mm, 13 to 15 mm. But I have come across even 3.5, even 3.5. The people, I have seen people who have underwent operation. Even I have handled a case of the cervical canal stenosis of 1.8 mm. This we can see actually here, the space should be this much. The disc has encroached. Here we can clearly see. So this should be like this, and this much of space has been encroached. Only this much space has been left. These are multiple canals stenosis at different levels. This is cervical cord contusion. We can see here the vertebra is injured because of trauma, and we can see the cervical cord contusion. So this is ankylosing spondylitis, where inflammation of the vertebra, the vertebral joint, they gradually fuse and they form bamboo spine. Here we can see it's fused. So what are the common symptoms we come across? Because various pathologies already we have discussed at cervical level. In general, the patients comes with different symptoms: pain in the neck, swelling in the neck, pain radiating to the shoulder, pain radiating to the entire arm, burning sensation and numbness in the entire limb, loss of function of fingers and limbs, emaciation of muscles, occipital headache, tingling sensation in fingers, especially thumb and ring finger. These are all common symptoms we'll come across when you handle various underlying pathologies. Thoracic region. So in thoracic region, we can see the osteoporotic vertebral compressive. Today we will speak only about this. Usually the commonest, most commonly in women, especially who are suffering from osteoporosis, with a simple injury, a simple fall, they suffer from this osteoporotic fracture. It will be highly painful. They cannot even sit erect. They have to lie down in the bed. Even some of the patients I have seen, even they cannot walk, everything, they will be bedridden. They will be bedridden. Excruciating pain will be there. A similar way in the lumbar region, again, the disc prolapse and unilateral the narrow root compression. Similarly, this is neural phenomena where nerve root is irritated, compressed. You can see this. So these are all the X-ray, the MRI views that the size of the neural phenomena here, its spiral size of the neural phenomena is decreased. So where it compresses the narrow root. So spondylolisthesis, grade 1, grade 2, grade 3, grade 4. So how it will be in the X-ray, you see it should be here, and it when misplaced, these vertebrae will be fused with the help of artificial plates and screws. So this is sacralization of vertebra. This is partial and this is complete. Means L5 vertebra, this is L5 vertebra, this is fuses with sacral vertebra. And this is X-ray film. Here we can see sacralization. So this is cauda equina. Usually spinal cord ends at in between L1 and L2. And from there all narrow roots, they form like a horse tail. And they come out of the respective vertebra. When the disc prolapse above L1, a strong prolapse from L1 to L1, L2, lumbar vertebra happens, then the cauda equina syndrome will happen. Signs and symptoms of cardiac equina. One more thing is the similar symptoms, that is pain in the neck, pain radiating to the buttocks, pain radiating to the entire leg, the numbness of the leg, even it may go up to foot drop. Even the extreme cases, there might be emaciation of muscles in lumbar area also. We can see such type of symptoms, and depending on the nerve root involvement, the pain may be anterior or maybe posterior or lateral, especially L5 peroneal muscles. Different clinical pictures will come across. Signs and symptoms of cardiac equina, urinary retention, the most common symptom, urinary and fecal incontinence, saddle anesthesia, sensory disturbance, which can involve anus, genitalia, and buttock regions, weakness or paralysis of usually more than one nerve root. Usually this particular condition better in a multi-speciality with the help of different disciplines we have to handle, better not to handle individually. But this type of cases also in the early stages when we'll handle, we are getting good results. Coccygeal pain. So injury to coccygeal bone leads to trauma, prolonged sitting and unimpaired cycling. The patients will have excruciating pain. They cannot sit on a hard surface. It's very difficult for them. Usually in net available donut cushion pads, usually the special the arrangement will be there. Only on that people can sit. And the common symptoms, either irrespective of the origin, pain, burning, numbness, weakness, loss of function, emaciation of muscles, difficulty in walking, foot drop, difficulty in standing, difficulty in sitting, difficulty in bending, difficulty in lying down, difficulty in turning in bed, difficulty in lying in ventral position, pain in the lower back only. Means from a simplest case to a toughest case, these are the ways we will receive clinical presentations. Pain in the low back radiating to either one side of the leg or both sides of the leg, pain in the anterior aspect of the thigh, lateral aspect or peroneal area, pain in the foot, anterior aspect, pain in the then somehow because nowadays in practice what I have observed is people when they are coming for one complaint, they won't come for only a pure one complaint. Occasionally you will have such type of complaints. Otherwise patients will have suffering in different systems. The majority of the people nowadays, they will have acid eructations, burning sensation in stomach, heaviness in stomach, indigestion, slow digestion, abnormal vaginal discharges. When you want to, because maybe a primary low backache may be associated with these things, or otherwise these are primary and over a period of time they have developed secondary low backaches. But certainly we have to answer all these symptoms. Gas in abdomen, constipation, history of chronic constipation, diarrhea, dysentery, chronic cystitis, and prostatitis presentation. So usually when we sit in OPD, people come on their own with the walking and say they're suffering from low backache. Some people, certain times the pain will be so severe, even severe pain. To severe pain with limping, bending on either side, severe pain, able to walk with the help of a bystander, or people will be suffering from low backache in wheelchair. People brought on hands or a stretcher. These are various presentations will come across. We can understand the severity of the low backache, or even similar way cervical problems also. Piriform syndrome, these are differential diagnosis. Investigations, CBC, these are common investigations required. And Katigraha, Prushtagraha, Grivagraha, Manyastamba, these are all various. Allopathic management, these are all various drugs used to treat low backache. These are all various physiotherapies used to treat low backache. Various surgeries on spine. Usually in my practice, because mostly I'll speak about my practice apart from text, because slightly practice we have to deviate from text and we have to use our own yukti. we need not require so many drugs to treat whatever problems earlier I have mentioned. Hardly 10 to 15 drugs are sufficient to treat these problems. So the first drug is 𝒂𝒂𝒏𝒃𝒃 ras, 𝐒𝐾𝐬𝐽 ras, rasraj ras, brodhvata chintamani, swarnayogaraj guggulu, amvatar ras, kanjanikar ras, vatavithwamsin ras, and rasabhasma capsules. Other drugs, lakshadi guggulu, septilin tablets, myostol, vishatindukuvated lumpatone capsules or surveillance capsules. These are the drugs sufficient to treat the various types of disorders, whatever I have told, at different levels of spine. Only these are the drugs I am using in my practice. This is for experiment, because only one thing we have to remember is only by giving internal medications, we cannot handle a wide range of spinal disorders. I have already given the various pathologies, spinal pathologies, and at the same time the suffering. Depending on the suffering, there is a requirement of the people with simple low backache or moderate pain, only restricted to low backache. We can suggest internal medications and external oil applications. But other cases where the pain is radiating to the legs or cardiac, osteoporotic fractures, all these cases preferably require inpatient admission. And my experience is all those patients I used to admit in ward and I used to treat. And later I will show you all the cases. And 𝒍𝒏𝒃𝒃, 𝒍𝒏𝒃𝒃, Muruvenna, Balaguduchadi, Suptihar 𝒍𝒏𝒃, any elements, any of the 𝒪𝐻 𝒍𝒏𝒃, 𝒪𝐻 𝒍𝒏𝒃, 𝒪𝐻 𝒍𝒏𝒃, 𝒪𝐻 𝒍𝒏𝒃, 𝒪𝐻 𝒍𝒏𝒃, Prasarnya 𝒍𝒏𝒃, Karpasasthya, and Paridakira 𝒍𝒏𝒃. These are all. And these 𝒍𝒏s can be used even other wide range of musculoskeletal disorders also, which I am going to handle later. So, especially for associated complaints, these are the common drugs I use: Sukumar Kashayam, Indukanta Kashayam, Laksutsekar Ras, Lasunadivati. My experience I use for purgation Kayam. Even 𝐒𝐩𝐢𝐧𝐚 also at one point of time I use, depending on the case. This is most important, because suppose if we are handling a very severe case, whatever we say that the Kativasti is important treatment for handling a case of low backache, this may not work out, because in severe pain we have to carefully observe in which position patient can comfortably lie down. On certain occasions, patient will provide us only one lateral position where they can lie down comfortably and allow us to do procedure at least for 20 minutes to half an hour in the initial stages of treatment. We have to utilize only that position. Before starting treatment, we have to examine the patient thoroughly and what are all the positions which are comfortable to do treatment without creating any new pain. Otherwise, if we are not following this, forcibly we will ask the patient to lie down in ventral position. Certainly the pain will aggravate. Within 3-4 days, patient cannot tolerate, and usually they will go away from the doctor. This is my personal experience. We must be very careful in handling severe cases. The position is also most important. What are the various external procedures we can use depending on the situation? Thylapichu, Abhyanga gentle, Patrapotali Sveda, Dhara local, Kativasti, Nadi Sveda, then Navaratepu, Navarakili, Mamsakili, Rukshapidda Sveda, Valaka Churna, and various vastis, Matra Vasti and Bolari, and various types of vastis also we can use. I have used very minimal vastis because with above external procedures also I could manage even tough cases. In very few cases only I have used vasti treatment. And one example, one patient I have received that she was brought on stretcher. And when we have observed that the patient cannot even tilt in bed, everything, even she has to pass her urine, motion, everything in bed only. At that time, we have to do some treatment on spine, but she is in only dorsal position. Then what to do? In such cases, what we will do is keep one rubber sheet over that, just arrange a cotton soaked in oil. Over that, the affected part will be, the patient will be made to lie down. Like that, 5 days, 1 week, 10 days, gradually the pain will subside, and it will allow us, the patient can move here, turn this side and that side, or even certain patients, they can get up from bed. Then you can use the other positions to treat, and other procedures also you can use. Otherwise, just I wanted to do, because patient cannot use any of the other positions. So this is the way you have to use the yukti. Then usually in cervical level, 3.5 canal, usually I said 13 to 15 mm, but by the time 5 mm, if they say at cervical level, usually doctors will be in hurry of just undergoing operation, ask the people to just undergo discectomy and other various types of procedures. Similarly, at lumbar level also, if it is the canal stenosis less than 5 mm, they prefer surgery. And similarly, the neural foramina compromise and other things also, they prefer surgery. But at lumbar level, only one case I have handled, L4, L5, almost zero space, nil space. But even 3.5, 2 mm also, number of cases I have handled. Cervical level 1.88 mm, 1.8 mm I have handled one case. The rest 3.5 happily we can manage, but they require, it's not just within 2 weeks you can handle those cases. They require long-term treatment, long-term follow-ups. My observation is whatever amount of surgical outcomes they got, similar amount of outcomes even without treatments they got. But it took some amount of time. In case of osteovertebral compressive fractures, we have better treatments. The patients will recover very fast with our speed treatment. I have handled a case of spondylolisthesis up to grade 3. Beyond that, I have never come across. Grade 1, grade 2, comfortably we can treat with Ayurvedic managements. Low back pain with bowel and bladder incontinence, very few cases I have handled, but we are getting good result. Post-surgical relapse. Every month I used to receive at least 2 or 3 cases where patients have undergone surgical procedure, and within 6 months or 1 year, the condition has relapsed. So such type of cases also successfully managed. Post-surgical sequelae, certain times after operation, patients may develop paraparesis or paraplegia or bowel incontinence, bladder. Such type of cases also with our treatments, we are getting good improvement. Neural foramina compromise also we are getting, but it will take a lot of time. Partial and complete sacralization of vertebrae. If patient is getting severe pain on repeated occasions, even after treatment, they require inpatient admission and they require repeated treatments. But once when it has subsided, they are comfortable. Then this is all about spinal disorders. Already, what is the financial burden of spinal disorders in India? We have seen. Suppose if we can turn patients towards Ayurvedic treatments, the financial burden of the country can be minimized to half. It can be halved, even much lesser with our treatments. Only one thing is, all Ayurvedic doctors must be skillful in handling, and we have to assure the confidence to the patients. Then certainly there is a big scope in spinal disorders. Then knee joint disorders, I have come across primary osteoarthritis, secondary osteoarthritis, meniscal tears, ligamental tears at chondromalacia patella. This primary arthritis certainly will, even in grade 4 osteoarthritis also will get good result. But in secondary osteoarthritis, where certainly you will have joint swelling and arm lakshanas, and then upsya, if you apply oil, the pain will get aggravated. Those cases are to be handled on AMA lines. Meniscal tears and ligamental tears, especially sport injuries and because of trauma, accidents, this is a comfortable area for Ayurvedic doctors. Maximum within 2 months without operation, we can handle meniscal tears and ligamental tears. The treatment procedures, whatever earlier said, the medicaments comfortably can be used even in meniscal and ligamental tears. And chondromalacia patella, grade 4 also I have handled, and the result is lasting for, I think, one patient I am following more than 10 years, comfortable. But they have to every day apply some amount of oil for maintenance. They are comfortable. These are all ACL tear, PCL tear, LCL, MCL tear. This is one case report I have kept. Like this, plenty of patients I have treated. You need not think that the tear has happened only. No, we have to send the patient for operation. You can manage comfortably these cases even at your clinic, and preferably in hospital, because the masseurs will be there. So many procedures you can do on the patients. Comfortably, we can handle these cases. There is no need of operation. And even after treatment also, I am following cases more than 10 years also. People are comfortable. Chondromalacia patella. Diseases of shoulder. This is a very good area for Ayurvedic doctors. Periarthritis, shoulder osteoarthritis, rotator cuff syndrome, dislocation of shoulder, bursitis, ligamental tears, and muscle tears. All these problems can be handled. One case, dislocation of shoulder, even after undergoing operation, repeated dislocations. One patient I have come across. For him, I did Thailadhara, and after that, Mamsanavara. And more than 10 years I am following. Absolutely, there is no dislocation of the shoulder, but we have to do more number of cases. Similarly, ligament ACT tour I have handled. Bursitis and other things, muscle tears, full length tear, partial tears, happily we can manage with Ayurvedic treatment. Similarly, the plantar fasciitis, it will be very painful for the patient. We have good treatments in Ayurvedic management. Tendinoachilitis, calcaneal bursitis, and calcaneal spur. Even calcaneal spur also we can manage with Ayurvedic treatments. But only one thing is, when calcaneal spur is coming, any amalakshanas are there that we have to verify. At that time, the thylas what we use will differ, and internally for subsidence of ama we have to use some medicines. Usually when there is ama, I use Kottam Chukkadi Thailam and Pitta Thailam. If it is a Kevala Vata, then I use Dhanvantaram Thailam and Murvenna. The results are excellent. The medicines and other things only within the range of drugs I have told. Those drugs only we can use, and we can successfully manage all these conditions. Elbow joint, medial epicondylitis, tennis elbow, lateral epicondylitis, follicular and bursitis, and tennis elbow. All these conditions happily we can manage with Ayurvedic medicaments. Disorders of the carpal tunnel syndrome. So if it is in diabetes, usually I use Balaguduchari Thailam, especially Thylapichu and bandage. Trigger finger, usually when flexor retinacular injuries, triggering finger, 3 to 5 cases I have come across. Usually Dhanvantaram Thailam, Murvenna, Pichu on the affected injured part, if you keep and tie, within 1 or 2 months people will recover. Tenosynovitis and tendinitis also similar way we can manage. So this is my presentation regarding wide range of spinal disorders and various musculoskeletal disorders on various joints. Devesh, now I am going to show you the testimonials whom I have treated. All these patients whom I am going to show they have been asked for surgeries by various patients. This case is a cervical cord contusion. More than 2 or 3 surgeons suggested operation. And whereas we have handled this case in our hospital, it took 3 months for us. Even while handling this case also, most important is this patient only Just please
திருப்பி
wait.
வச்சுக்கோங்க.
Devesh, wait.
திருப்பி தூரமா போயிட்டு எடுத்துக்கோங்க.
Devesh, wait. Devesh, wait.
எடுத்துக்கோங்க.
Devesh, wait. So previous slide, previous one, previous video clip, Devesh, previous video clip. Yes, stop there. And patient is with hard collar. We must be very careful. This is the picture we have taken on 8th day. Day 1, even he won't permit 1 centimeter movement, won't allow us to remove the hard collar. At that time, simply we have pushed the cotton inside this collar, and we have sprinkled Mahanarayana Thailam. Like that, after 8 to 10 days, some amount of pain has reduced. Then we could able to open. Then slowly we did Abhyanga, PPS, Dara. It took 3 months for us to make this patient walk. The advantage is, even if he would have undergone operation, probably he would have lost his left. Usually he would have been on wheelchair. But this case has been handled in 2004. Even today, he is looking after all his normal works. Alone, he can travel anywhere. That is the advantage of Ayurveda. But while handling such type of cases, multidisciplinary approach is comfortable. Otherwise, these people, they develop catheter-related infections, fever. Certain times it is difficult for us, unless if we are capable in handling all those things. But patients will have more benefit, both if you can follow the early stages, if you can follow Ayurvedic treatment. And similarly, such type of cases who have been operated and who have been brought on wheelchairs, there is some amount of improvement we did not get. We could not restore their legs. Next, Devesh, next. Next slide. This is cervical motor radiculopathy. You can see the difficulty of the patient to take the cell phone. This case has been successfully handled. Devesh, stop. This case has been successfully handled, and the limb power has been come back to normal. But of course, the post-treatment clip we could not procure. In this case, I have used Mahanarayana Taila and Mahamash Taila for Abhyanga, PPS, and Dhara. And apart from that, in this case, we did Mamsa Dhara. She has absolutely recovered. Start. Devesh, start. This is a post-surgical relapse. The patient underwent surgery. Within 6 months, again, he developed severe low backache. And again, doctors advised for second surgery. At that time, he visited our hospital. And we have treated him for 28 days. Subsequently, another 2-3 times we have treated this patient. I have discharged this patient on 31st March 2005. I remember the date. Even today, he has not undergone any operation, and individually he can do all his works. So even post-surgical case, because youngsters, especially students who are watching, you can handle these type of cases also. But only one thing is, you must be very careful. You should not hand over the entire cases to masseurs. The technical skill is required. You have to, under your supervision only, these cases are to be handled. Next. This is a case of acute IVDP. I think before treatment we have missed. Devesh. Before treatment we have missed. Acute IVDP. This is the way people, they walk. Very severe pain. His posture and gait also changed. Devesh, next. This is also motor radiculopathy. Next. Just next. Yeah. This is also, you can see the gait of the patient. This is before treatment. Such type of severe cases also you can handle, and they will get absolute improvement. Students, you need not afraid. But only one thing is, before that, you must be aware of theory and what are all pros and cons. And this is, well, immediately after first treatment, this patient can move anywhere now. Even he individually can travel in buses everywhere. This is also another case of Devesh, another case of motor radiculopathy. Just slightly move forward. This is another case of road injury. The police inspector met road accident. Canal for 0.4 centimeters. I can see the gait before treatment and after treatment. Being a police, he has to do march. He is able to do, and he continued his service for another 3 to 4 years. So this is a case of osteoporotic vertebral compressive fracture. Very severe pain patient will have. The other side you can see comfortably sitting, comfortably walking. This is another case, canal stenosis and multiple pathologies, almost bedridden for more than 60 days and suggested for surgery, whereas this gentleman received 21 days of treatment. After that, even today also is quite comfortable. And this is a Devesh stop. In this particular case is very interesting. The lady who is walking is an engineering graduate. During her farewell party, somebody removed chair, and she thought she's sitting in chair, and she fell down on floor. At that time, she has not developed any complaints. Over a period of 1 year, slowly she developed weakness in her lower limbs, and ultimately found that this is a case of some blood vessel injury, and ultimately the destruction of spinal cord, non-compressive myelopathy. And she has visited all hospitals. There is no improvement in gait. After 2 years, she came to our hospital. So at that time, within 21 days, she got very good improvement. The first instance, to walk for 20 feet step, it took 147 seconds. After 21 days of treatment, within 37 seconds, she could able to walk. Please play. Devesh, play. You can observe before treatment and after treatment. The after treatment clip is over within 37 seconds. Before treatment, she will walk for another 1 minute 10 seconds, 110 seconds. Devesh, move forward. No, some more cases are there. No. Again, we have come back to the slide 1. Still some more cases are available.
No, sir. That was the last, sir.
Okay, it's okay. Even some more slides are there, but we could not arrange. I think I have given you, especially students, I wanted to give a message that our treatments are highly effective in various spinal disorders, similar way in other musculoskeletal disorders also. First of all, we must be aware of the theory, and we should study very well about various drugs and how to use. And before treating the patient, we have to understand the range of problem and what is happening inside. Then certainly you can handle these cases. Right. Thank you.
Thank you, sir. So this is like a very informative and a very descriptive session. So I hope कि बहुत से लोगों को आज के इस सेशन से काफ़ी मदद मिलेगी to treat the spinal disorders and to treat the other lumbar disorders and other spinal cord related disorders. So I'm waiting for how to diagnose through Ayurveda. Dr. Trivedi Ashish wants how to diagnose through Ayurveda. He wants to know, but what type of diagnosis he wants to know, I don't know. He not mentioned that. His question is only how to diagnose through the Ayurveda. Dr.
Okay.
Ashish, I would like to request what type of diagnosis you want to know about. If there is there any particular disease diagnosis or it's related with the spinal cord.
I'll speak.
Yeah.
Dr. Ashish, I think Ashish asked this question. In our textbook, they have clearly mentioned certain of the disorders. Those things, the clear picture is there. It is not difficult for us to understand. But the detailed anatomical understanding is not there with us. But that is also important when you are handling very tough cases. But even if it is not there also, you just imagine the whatever treatments we are following, we are getting improvement. But the symptomatology is most important. If numbness is there, Suktitailam we are going to use and other things. And depending on the area of the affliction, suppose if the problem is in the neck, the problem is radiating to the hands and other things, what is the area we have to handle, we'll come to know, like basing on the underlying what we call the description of the disease with 𝒀𝒐. Suppose if it is in the symptoms and signs, if you are seeing in the lower back, you can understand. But with our understanding, you cannot pinpoint the sacralization and other things, but that is also required because the long-term outcomes, if you want to expect, certainly these things are helpful. With regard to the diagnosis, what my personal feeling is, allopathy is advanced. With regard to the treatment and the management, we are so advanced because you see, when 4 surgeons, 5 surgeons, they said it is only operation, this case has to be operated, whereas our simple drugs, they are doing miracles. So basing on symptoms, also basing on numbness, basing on pain, basing on severity of the pain, the radiating pain, we can manage with our drugs.
What treatment option do you typically recommend? Do you typically recommend in a spinal and musculoskeletal?
I have already clearly,
Yeah.
told what are all the procedures I am going to use. Simple Abhyangam, PPS, Tailapichu, Dhara, then Shashtikishali, Mamsanavara, and Vastis. But Vastis had very few options. Few cases I have used. Mostly I with external Kativasti and other things. External treatments only I have managed all these cases.
What are the most common disorders you encounter in your practices?
Whatever I have listed in this particular presentation, everything I have seen, everything I have treated. Whatever I have shown, everything I have treated.
What are the available treatment options for spinal and musculoskeletal disorders?
Again, question is repetition.
Repetition only.
Repetition. All external managements, what I have suggested in this presentation, can be safely used. Oils differ. Suppose if you are using cervical pathologies, use Mahanarayana Tailam, Mahamasha Tailam, Prasarinyadika Tailam, such type of oils you use. Suppose if you are handling lumbar pathologies, Dhanvantaran Tailam, Murivanna, Bala Tailam, 𝐻𝐕𝒅𝒊𝒂𝒏𝒏𝒆 like that. When you are practicing, practice will teach you everything. This is a bird's eye view. It's not that I am making you spinal experts in just 1 hour lecture.
Exactly. Can physical therapy and exercise manage spinal and musculoskeletal disorders? By Jagdish.
Okay, this is a very good question. You are asking that the physiotherapy will be better or Ayurvedic treatments are better. My question is something different. Whomever I have come across, they all, those patients, they have been subjected for physiotherapy and all other treatments. At last, they have been posted for surgery. It is not that the cases whom I am receiving, straight away they are coming to Ayurvedic treatment. Initially, they will be subjected for various physiotherapy and physical procedures. Later, depending on their suffering, they will be opted for surgery. And once when they have been told surgery, they will come here. There are certain cases who have taken their operation date, admitted in hospital, and from there also again they have discharged and they have come to our hospital. We have treated those patients.
Okay.
If physical therapy can treat, there is no question of surgeons telling operation is required.
So here is one question also. What are the some risk factors associated with developing spinal and musculoskeletal disorders?
Yeah.
Dr. Rahul wants to know.
Yeah, especially in cervical level and lumbar level, especially if the cord compression is there, patient, the stenosis is very severe. We must be very careful, especially in lumbar vertebra. There are multiple what you call disc prolapse and the compression and cauda equina. The people will develop loss of sensation in buttocks, lower limbs. Those are the cases we can handle, but not alone. With allopathic assistance also we can handle. One case only I have handled. Recovery is good, but we have so much of difficulty while handling. Better not. And similarly, when you are handling trauma on spine, people with paraplegia, with catheterization, they develop catheter-related UTI, high fevers, especially trauma on spine, especially cervical spine. The pain will be very severe. Certain times they develop neurogenic shock. One case it has happened. So we must be careful. And we must be meticulous in handling those things. As an youngsters, beginners, better not to handle.
I think all queries are resolved. So one more question is there. In ankylosing spondylitis and bamboo spine, how to approach?
In
Do you
ankylosing
want to know?
spondylitis, definitely it's an inflammatory disorder. We have to treat on the grounds of Urustamba. The thing is Yoshadi Gulu and mostly Churna Pindasvedam. Results are very good. But absolutely if used, and if you are not old case, not finding Amavastha much, at that time you can apply oil like Kottam Chukadi Tailam, Pinda Tailam, and you can do Patra Potli Svedam. Some amount of mobility we can expect in patient.
Okay, sir. Thank you so much on behalf of Dabur India Limited.
Now
For
questions has
sharing
been
your-
finished, sir.
Sorry, pardon?
क्वेश्चन फिनिश हो चुके हैं, सॉरी.
Okay, thank you so much. Okay, sir. Thank you so much for your valuable time and a good lecture session for the spinal disorders and your vast experience. It's around 35 years of your experience of treating people and the experience of पंचकर्मा. So मुझे लगता है कि बहुत से लोगों को आज काफ़ी हेल्प मिली होगी इस चीज़ के लिए, एंड द वीडियो टेस्टिमोनियल्स जो आपने एंड ऑफ द सेशन में दिखाए, सो उससे और ज़्यादा ट्रस्ट मिलता है कि हम टुवर्ड्स आयुर्वेदा स्पाइनल डिसऑर्डर्स के लिए बहुत अच्छे से काम कर सकते हैं. So thank you again. Thank you so much.
Thank you.
And also wants to thanks the Indian Vaidyas platform for this webinar also. So again, thank you so much, sir.
Thank you. Thank
We
you.
will plan our
Thank you,
next
sir. Thank you
webinar
so much.
with you with your clinical experience, because I think there is the shorter time of 1 hour for the today's session. We will again plan the another session with you. Thank you, sir.
Thank you. Thank you all.
Okay, sir.